Introduction to Atherosclerosis and its complications. What is atherosclerosis? Atherosclerosis is a type of arteriosclerosis, but arteriosclerosis and atherosclerosis are not the same. Arteriosclerosis is a general term. It means the hardening or sclerosis of an artery. This can be from a variety of causes, and some arteriosclerosis occurs naturally in aging adults, but there's another type of arteriosclerosis called atherosclerosis, and this is very pathological. Atherosclerosis is the hardening of arteries by athero, or atheromos, which mean in Greek something like gunk. Atherosclerosis is the gunking up of an artery wall with plaque. A little mnemonic is that atherosclerosis makes it difficult for blood to go through an artery. This is a nice little picture of atherosclerosis. In this case, we have a patient who has his coronary arteries are affected by a plaque buildup. So you'll notice, remember, the inside of an artery is called the lumen. That's where the blood flows through. And in this clean artery, blood can flow through unimpaired. In the artery with a plaque buildup, we have abnormal or turbulent blood flow. And that's because there is a plaque overgrowth here. So notice the lumen is reduced to about 40%, and the majority of the lumen is covered by this nasty plaque here. And this is a coronary artery. This is an artery supplying blood to the heart. And we're going to talk about the problems and the complications you have with advanced plaque growths in coronary arteries. But what is first of all, what is plaque? The terms atheroma and plaque are, for our purposes, essentially the same. So it's okay to say that atherosclerosis is plaque buildup in the arteries. Technically, though, atherosclerosis denotes not just plaque buildup, but the hardening or sclerosis of the arteries due to the negative effects of plaque buildup. Plaque is a composite mixture of cholesterol, calcium, and some other materials floating in the blood, like dead or living white blood cells, clotting factors like fibrin, etc. So where does plaque buildup occur? Atherosclerosis is most common in large and medium-sized arteries. Unfortunately, it's most common in very important arteries like your carotid arteries, your aorta, your coronary arteries, and your cerebral arteries, the arteries supplying your brain. This is unfortunate because those are all supplying extremely important organs that have a sensitivity to blood perfusion. They need enough blood constantly. So this is where we're kind of foreshadowing the problems of atherosclerosis. So what are the problems of plaque buildup? They're not really that difficult to imagine. First, there's three really important plaque problems that come with plaque buildup. First is that plaque obstructs blood flow. This is obvious just by there's not much room in your arteries already, so if you have plaque in there, it's going to obstruct blood flow. Second, the plaque could break off and lodge itself in a smaller vessel, a smaller artery. And third, the plaque could cause a blood clot to form, which in this case is called a thrombus. And that clot could either block the lumen further, or that clot could dislodge, and then it could lodge itself in a smaller artery. And we're going to have a lot more on that later. This is basically how a stroke or a heart attack occurs. This is a nice little image of a carotid artery with a very advanced plaque in it. You'll notice here that the lumen has been reduced to about 20% or so, and it's extremely narrow due to this plaque. Coronary artery disease is a disease of the coronary or heart arteries. But coronary artery disease is kind of a confusing term because it's not actually a disease. It's an umbrella term which contains several diseases which have the same cause. Coronary artery diseases are caused by plaque buildup in the coronary arteries. The most significant diseases under the umbrella term are myocardial infarction, or this is colloquially known as a heart attack, and angina. And we're going to talk way more about these in subsequent lectures. But this is just a little overview. So again, the coronary artery diseases have a common etiology. That is, they are caused by plaque buildup in the arteries. Not just the arteries, the coronary arteries. It's very easy. Plaque causes chronic irritation to the artery. This is another problem of plaque. So aside from the fact that plaque disrupts blood flow, it also causes chronic irritation or injury to the arterial wall. So the plaque is irritating, and it can cause chronic inflammation or injury at its site, and the site is the artery with which the plaque is anchored into. That's actually why the sclerosis occurs in the artery, the hardening. This chronic injury will lead to a remodeling of the artery, and this means a harder fibrotic replacement tissue will replace the injured normal endothelium of an artery. In general, this is kind of a general rule of thumb that we'll come back to in pathophysiology, but fibrotic replacement tissue is better than nothing, but it's largely non-functional. So for instance, if a part of your heart tissue dies, there will be a fibrotic replacement. The problem is that it won't conduct electrical impulses the same way, and it won't contribute to cardiac workload. It's effectively dead weight. Anyways, we say that these injury-induced changes in the heart, in the artery wall, will cause a series of histologic changes. That means the tissue which makes the artery undergoes changes due to the plaque. So the artery is affected in multiple ways, but let's go back to impaired blood flow for a second. To visualize this, you can imagine a hose with a rock or a large marble lodged in the middle of it. And before we talk more about impaired blood flow, it's good to know that the following types of patients are particularly prone to atherosclerosis. Some for known reasons, some for not 100% understood reasons, but these are a general rule of thumb. When you're in the hospital and you have how many patients on your shift, and you know you have a diabetic or a smoker or a patient with high blood cholesterol, that is high low density lipoprotein or high triglycerides, you're going to know that they are at risk for plaque formation, for atherosclerosis. So I mentioned that plaques can cause blood clot formation. But how is that? Well, part of this phenomenon is related to impaired blood flow. So again, there isn't much room inside your arteries. So if you start lining the walls with kind of a rough and bumpy gunk, you're going to disturb blood flow. When blood flow is disturbed, we say the flow is turbulent. That means it isn't regular flow. Instead of proceeding regularly, as in figure A here, blood flow is chaotic, oftentimes slower than normal because of that chaos. It's speculated that this slower than normal blood flow can be partially responsible for increased occurrence of blood clot formation, or thrombus. So remember that a blood clot when it's formed inside an artery, is not called a blood clot. It's called a thrombus. But it's the exact same thing as a blood clot. It's just inside the artery. So the difference between a blood clot and a thrombus is simply location. Blood clots occur outside of arteries. Inside or within the artery, a blood clot is called a thrombus. And though the exact cause of thrombi formation isn't completely understood inside the artery in relation to plaque, we do know that plaque buildup puts a patient at heightened risk for whatever reason for thrombus formation. So again, at the top we have normal blood flow. Normal blood flow, this is just a little physiology review, but normal blood flow has this what's called a parabolic profile. It's this kind of curved shape where the center of the blood travels faster than the outside layers. So this is also called laminar flow. The outside layers have more contact with the wall and there's more friction, so they travel slower than the middle, which the middle travels faster. Though there are natural places in the body where there is expected chaotic flow, plaque buildups will cause unexpected chaotic flow. And this occurs in nature. If you have, say, a creek and there's a bunch of rocks, you'll have a somewhat turbulent flow instead of a nice laminar flow. But this can be problematic because it can cause blood to slow down, and there's a greater chance when blood's slowed down for clotting to form. That is inappropriate clotting or thrombi formation. There's the very important tissues are those like the heart and the brain. So when we have either impaired blood flow or we have a completely occluded vessel leading to the heart, there's going to be complications with this. In this case, this is what a heart attack would be, or a myocardial infarction. And there's going to be tons of lectures on myocardial infarction and other ischemic heart disease. But this is the general pathology you need to remember, is that you're going to have a plaque buildup. And that plaque buildup itself could be causing the problem, or it can start an inappropriate coagulation cascade and an inappropriate clot formation, which is called thrombus. And a thrombus can get lodged in an artery. So remember that your left ventricle especially needs blood. It pumps harder than the right ventricle, and it often can only receive blood when it isn't contracting. So if the left ventricle is not getting enough blood, the patient might start feeling chest pain. This chest pain is a condition called angina, and there are several lectures on it, so don't worry about it. This one's just an overview. Finally, the last problem with plaques is that they are friable. This means that they can easily break or dislodge. When this occurs, they are no longer called a plaque, but an embolus. The same goes for a thrombus. When a thrombus dislodges from its spot and floats in the blood, it becomes an embolus. Embolus comes from a Greek word meaning something like stopper, because it stops up, I guess, bottles. Emboli will travel down vessels until they get lodged in a smaller vessel. So if in this diagram, this is, we'll say, like a plaque that is dislodged from its site and now has become an embolus. And it's okay here because blood can still get around it, but it's not until it gets to this bottleneck where it causes, in this case, a complete obstruction, and blood flow cannot proceed. So if this was a artery supplying the heart with blood, this would be causing a heart attack right now. So when a vessel's blocked, there can be a ton of consequences. Obviously, blood flow in that particular artery is going to be reduced. But why is that exactly bad? Because usually an organ has more than one artery supplying it. Well, some tissues can't handle reduced blood flow at all, especially the tissues in the left ventricle. If an artery supplying your left ventricle gets blocked, the heart muscle in the left ventricle myocardium, that's the muscle, is going to starve. This is called a myocardial infarction, or a heart attack. Your heart is being attacked because a blockage is starving it of blood. If the embolus blocks a vessel supplying your brain, then your brain will be starved of blood. But instead of calling it a brain attack, we call it an ischemic stroke. So this is the slide. I forgot to hit enter here. So again, this is the overview of what a heart attack is, or a myocardial infarction, and an overview of what an ischemic stroke is. But we're going to talk about these in a greater detail. So to sum things up, a plaque buildup can cause problems just by its being there. If it grows too big, it can restrict all or a large portion of blood flow to a particular through a particular artery. Moreover, atherosclerosis has that sclerosis part, which means that the intima, or innermost tissue of the artery, scleroses or hardens. This decreases the artery's ability to dilate. And we're going to talk more about this later, so don't worry if it doesn't make sense now. But when an artery can't sufficiently dilate, the body's attempt to increase blood perfusion will fail. Finally, if a plaque ruptures, it can fragment into an embolus, or it can rupture and begin an inappropriate clotting process, forming a thrombus, or a blood clot in the artery. This too can obstruct blood flow in the artery, or the thrombus can embolize and fully occlude a smaller vessel. And here's a final couple notes. So why does smoking make atherosclerosis worse? So for whatever reason, smoking increases the blood's tendency to coagulate or clot, as well as it increases plaque formation and causes generalized vasoconstriction. So none of these are good, because when you have blood that's hypercoagulable, that means it's more prone to forming a thrombus in the artery. Also, what we remember that plaque can set off inappropriate coagulation cascades in the blood, which form clots. And then finally, if you have a plaque in your artery, the last thing you want is for that artery to get smaller. And finally, smoking damages arteries, which compounds on the damage already caused by atherosclerotic plaques. Remember that sclerosis is a damage to the artery. Some people ask, I've had students ask if atherosclerosis occurs in veins. We typically only worry about arteries with atherosclerosis, so that's why I have the A's underlined, so you can remember that. And the reason isn't necessarily because of the veins themselves or any special structure in them, but the mechanism of atherosclerosis still has a few mysterious components to it, but Some researchers once believed that the vein itself was somehow responsible for fighting atherosclerosis, but there's a few studies that show that veins grafted onto arteries still develop atherosclerosis. And this contributes to the general belief that the high pressure nature of arteries causes atherosclerosis more than the low pressure systems, because plaque formation in veins is not as common. And there's a nice little study here if you want to read more about that. So finally, the nursing implications. As a nurse, your patient is, if you have an atherosclerosis patient or a patient with atherosclerosis, whether that was just diagnosed or that's been known for a while, as a nurse, your patient's likely going to be very concerned about their atherosclerosis, but they might also be completely unconcerned and unwilling to change their lifestyle. And usually I found that patients will be somewhere in between. If the patient is concerned, they're likely concerned over their risk of increased MI, that is heart attack, or stroke. In this case, you might expect anxiety and fear, so that's good to put into your care plan. And here it's really important when you're in the hospital to reiterate that plaques can actually regress. They can regress with consistent adherence to pharmaceutical and dietary/lifestyle changes. You can check out the pharmacology section to learn about the nursing implications of a potential pharmaceutical regime and what your patient can expect. And then here's a nice little study that touches on the prevention and regression of atherosclerotic plaques and some of the emerging treatments.